about to get underway in Idaho's largest school district, West Ada, where masks and the mandates to wear them to help stop the spread of COVID-19, they were a constant concern during the last school year. Parents protesting or rallying at school board meetings, social media pages attracting hundreds and thousands of followers on both sides of this issue. Well, new year, same issue. Only this time around, the district is going in without a mask mandate in effect. They are leaving it as an optional choice for teachers, for students, and for staff, regardless of vaccination status. There's a chance, though, that could change because tomorrow, 2 days before classes begin, the West Ada board is going to meet to discuss COVID protocols, and they're going to weigh possible changes to the current plan. So is it possible the district goes from recommending masks to requiring them? To this point, we haven't heard much from Board of Trustees members, I should say, other than what we've heard them say during those meetings. For some insight on what is expected to be a contentious and, of course, a crowded board meeting, Joe Parrish spoke with West Ada Board of Trustees Chairman Amy Johnson, as well as District Superintendent Dr. Derek Bubb. For starters, here is what you can expect tomorrow night.
There is a lot of information floating around in our community right now around facts and data and information, our hospitalizations, our child severity rates, our spread rates around COVID. And then we also have a number of parents in different family situations. And so what we want to do for sure before we start the school year is have a good community discussion around where we're at and where we believe we should start the school year. And the way that the public process works for school boards is we can't have that discussion without doing it in a board meeting. So tomorrow night's board meeting is for us to sit down, have that conversation. We're going to have medical professionals there. Dr. Souza from St. Luke's Hospital is going to join us. Dr. Bubb is going to walk us through some different options that we have. We're going to hear from our community members, and we've been hearing from them already, both in emails as well as we've actually got some video chats that have come in. And then we're going to hear from them. And then the board and administration, we're going to have a discussion and we're going to figure out if we need to change where we're at from our policies, and if we do, what we want to change it to start the school year on Thursday.
And will that decision be made tomorrow night, or will it be considered tomorrow and then I guess quick action before Thursday, or maybe even after Thursday?
So to be honest, the answer is I don't know, because we don't have to make a decision to change where we're at. Right now, our policy allows Dr. Bubb to change our mask policy at any point. So the board doesn't have to make a decision, but we haven't as a board even been able to have a conversation together with Dr. Bubb to do that. We have to do that in a public open meeting. So the answer is we can make a decision tomorrow night. We don't have to. If we believe we're comfortable with where we're at and where we want to go, we can end the night just like that as well. We want to make sure we have the discussion and we do our due diligence as a team, and then we'll decide and we'll move from there. Whether or not a decision needs to be made will be up to the discussion and information. I
guess in general, from your perspective, both of you, the reaction from parents, no matter what they support or what they're against. I mean, what's your take on, the passion, as you highlighted? You're getting video messages and emails and thousands, I'm assuming.
Yeah, I would say, and I've said this before, this is obviously a divisive issue. I hope that at one point we can look at this in the rearview mirror. I think everybody hopes that one day we can look at this in the rearview mirror, but the passion in education is something that we need to be able to capture, and we need to be able to use towards educational needs for our community. I look forward to the day that we're sitting here talking about the amazing educational initiatives that West Ada is introducing. I think those things are happening as well. This happens to be a hot topic right now, and I understand. People want to be involved, and we need to be able to capture that involvement and make sure that that we use this as a catalyst to move forward in our district.
For the board and for you, Dr. Bubb, how has this been for a leadership perspective in terms of dealing with this? There's a ton of focus on it, of course, from the media and the community. And I'm just curious, from an inside perspective, kind of what dealing with all this has been like.
We've got, myself and the board have gotten to know each other really well over the last 30 days. So, it's obviously a challenging situation. There's no easy answer there. You can see this across every governmental agency, not just in Idaho, but everywhere. People are battling with this. I think it's created a solid foundation of communication between myself and the board, where we can really use that again to move forward at a future time where we can finally put some of this in our rearview mirror.
I think one of the lessons you learn when you get in these roles is that we're both parents with kids in the West Ada School District as well, is that making the decision for our individual kids is really easy. Making the decision for everybody else's kids is really hard. And there's a lot of sleepless nights and a lot of up and down and a lot of back and forth trying to figure out how to do this right. And frankly, we try as hard as we can to make sure that we want to make it work for everybody. I know we know that's not possible, but that's still something that we individually and as a group collectively try and achieve.
Dr. Bubb, I know that earlier this summer you were given, essentially unilateral authority to make major decisions, operational decisions. For you, is there a turning point where it would be a metric or a piece of data or public outcry that you would say, okay, we are going to require masks? There is a point to where I'm keeping my eye on, and when we hit that point, for me, I have to make a decision.
Yeah, I mean, obviously, as the policy says it, the board put a policy in place that gave me unilateral, if that's the word you want to use. But I think that the really important thing here is that the board and I work really closely together, and we work with our medical professionals to determine what is the best environment for our kids and the safest environment for our kids. So that is really a catalyst of this conversation to say, hey, this is where we're at today. Obviously, things have changed. In regards to numbers and things like that. I think it's good to have a good, healthy, honest, open conversation in a public forum where people can hear where we're at. That's the most important thing. As we learned last year, being flexible is the new skill that we put on our resume, and we really have to exhibit that right now.
All right, Joe, so it sounds like to me the West Ada School Board trustees gave that determination to the superintendent to make that determination, school by school, district wide, whatever, when it comes to masks or anything when it comes to COVID protocols. But there's a chance they could kind of take that back tomorrow night, if I understand that correctly, and make the decision as a board, right?
The way I understood it, Brian, is that they gave Dr. Bubb the ability to act on his own, but they didn't say, okay, you're the only one that's going to be in charge of these decisions. The Board of Trustees, as we heard from, they're going to have an opportunity to make whatever decision they find fit. I think the reasoning for giving Dr. Bubb the unilateral authority, as I put it, is just in case something does escalate quickly and they do need to act quickly. As it was highlighted in our story, the Board of Trustees, they have to meet in public to have conversations and make decisions. That's how open meeting laws work. So they can't have like back channel conversations and then have to wait a day or two if something urgent comes up.
Okay, and they're moving that meeting to the White Cloud Auditorium, by the way, because it's about 3 times as big as their normal meeting place, and they're only giving people about 2 minutes to speak. So it is going to be crowded, and of course, as you said, it's likely going to be contentious as well.